We're going to show you how we get pain and inflammation down faster than nothing else can. There's nothing that can get the inflammation and pain down as quick as cold laser or low-level laser therapy. Hello everyone, Dr. David Kulla here with Synergy Wellness, Chiropractic and Physical Therapy in New York City. We have, some of you are familiar with Mohammed, who suffers from Costochondritis, and it flares up from time to time. He drives a lot, so he's spending a lot of time sitting. And the last video I went over, one of the main issues for him is trying to get him to strengthen the muscles and to be more active, because when he's working, he's not really active. He's sedentary, sitting in a small car with an arm up on the steering wheel. So he's doing much better. Where would you say you are as far as when you the very first time you came in to see me with costochondritis?
Oh.
How much improvement? Where would you say you're at?
40%.
About 40%. Well, that's not good enough for me. So he expressed today that the thing that's the most effective for him for costochondritis, and this is important for a lot of you that are suffering, that maybe go to a chiropractor, do all the stretches. We've done a couple videos on stretches, and that may all help. That may help 20%, 10%. Some of you may help 50, 60%, and that could be a huge difference. But we want to resolve this completely. So it's often not just one thing that's going to fix this problem. So we're going to show you how we get pain and inflammation down faster than nothing else can. There's nothing that can get the inflammation and pain down as quick as cold laser or low-level laser therapy. We've got two lasers here. I'm going to show you how we do that. We're going to start lasering the back where the ribs meet the spine. We're going to start there, and then we're going to flip him over. He's got ice on his chest right now, right where the breastbone and the ribs meet, where a lot of his pain is. But he's also got some pain out on the breast area, but out wider, okay? So we'll go into that. So we're just gonna slide his shirt up. Now, I'm gonna sandwich, we have a couple of lasers here in the office, and I'm gonna go ahead and sandwich, really just do both sides of the spine so we can get just quicker treatment times here. Now, we've already done one frequency for him. It's been effective. Now we've moved on to a deeper frequency where we can penetrate deeper into the joints, in through the muscle tissue where the rib head meets the spine and the joint itself. Same thing in the front area. So we're going to go ahead and use that deeper frequency. Anywhere from 5 to 250 really is a good level. Hits more deep anti-inflammation, ligaments and tendons, a little bit deeper than say like 1,000 hertz. So we're going to go ahead, start him there, and then we're going to turn this laser on. This is a newer one, the MR5 Active Pro by Multi-Radiance. This is another Multi-Radiance one called the TerraQuant, and we're going to go ahead and do this one. It's just on a set frequency. This one here, I'm going to do a range for him here. Okay, we're going to start them both at the same time, and we're going to start up near the corner of the scapula for him. And this blue laser I have in my hand is a 50 watt. You can also switch it to 25 watt if you want. But that just means more power, faster treatment times. So you're going to notice that I'm moving this blue laser more often than I'm moving this laser that's on the tan arm here, the gray arm, okay? So it's just because this is a newer, more powerful laser, that's all. So with this one, it's 50 watt. We're going to do about 60 to 90 seconds, no more. This is a 25 watt, so we'll do about 2 minutes for that one, anywhere from 1.5 minutes to 2 minutes. And we're almost at 60 seconds here. And again, this is for deep anti-inflammation. So it's really going to reduce the inflammation much faster than anything else will. And it does it naturally using laser diodes. Now there's all sorts of different products out there, from LEDs and different things. I've done some videos on that. Check that out. And it explains the difference between an LED and a laser. There is a difference, okay? And this is a Class 1A FDA approved device. Very, very safe. Probably the safest of all. But safety comes first, so we might as well put the glasses on. If you live here in New York or in the New York, New Jersey area, tri-state area, we do rent these lasers as well. So that's, you know, an opportunity for somebody that has severe costochondritis to rent it for a week or two, and it will make a big, big difference. And we're going to go ahead and move this one down again. And right now he has some ice on his chest. Some people complain that the pain is just unbearable. It's so sharp and they can't even exercise because they can't take a deep breath in, or so it's hard for them to exercise. I understand that. And that's where this can really come in. It's just going to calm that inflammation down, calm that pain down quickly. Yeah. And you even said this is the most effective for you, yes, of all the...
Absolutely.
Yeah.
And now the pain can be unbearable. The pain is like, it's crazy.
Yeah, so you mix that with an adjustment with some postural exercises, and that's the magic key. That's the three that work in conjunction, in synergy together to fix this issue. It's not just one modality that's going to fix this, especially in a severe case. There might be some people that get relief just from the exercises, or just from the chiropractic, or just from the laser. You know, maybe some milder cases, but in severe cases, typically, it takes all three. Okay, now, so he's a hairy guy, right? Laser, if you're really, really hairy, I recommend shaving your chest. He's, you know, a little bit in here in the center, which we don't really need to get to too much. We can get around it. It's not bad, but anything more than this, I would not shave it, but trim it. Trim it down, and then, because, for example, if I were to do this laser over a white t-shirt, not bad. But if he had a black t-shirt, I wouldn't even attempt it. Ideally, though, I would like to get to the skin surface and not do it through a t-shirt at all. So, dark hair. So when you're doing it like on someone's scalp or head, you don't really have a choice. You have to do it through the hair. Nobody's going to shave a bald spot in their head. But on your chest, it's not really a big deal, okay? Especially when it comes to getting better results. So he's got some tenderness out here. And how about out here?
Yes.
Out there, okay. And in here?
Yes, exactly.
Okay, so we're going to do a couple of points here. Again, we're going to use the deeper anti-inflammation frequency here because we've already done laser treatments on him, a couple of them. And he responds better to 5 to 50 hertz. And then once we've done that, we're going to go on the inside where the rib meets the breastbone, the actual joint, the costosternal joint, okay, where the rib meets the sternum or again the breastbone. And this is definitely the most effective as far as pain relief and inflammation. I don't know of anything else that can reduce the inflammation faster. You know, oftentimes, did you try ibuprofen when you were?
Oh yeah.
Did it help?
It helps, but I mean, you know, it's medicine. You know what I mean? It's not natural. You know.
Yeah, and it lasts for 6 to 8 hours, right?
Yeah, and then you gotta keep. You know,
This tends to last longer and actually heals and repairs the soft tissue. So beyond reducing the inflammation and the muscle spasms, it's going to work to heal and repair the soft tissue and have a longer lasting effect, especially if you do the laser treatment over a 2-3 week period. And we've had some severe cases take, 4 weeks to 8 weeks. We had one girl, I think, 2-3 months. And it wasn't until we switched the frequencies on the laser that she got much more benefit from the laser. So if something's not working, you're getting cold laser therapy and you've done 3 or 4 or 5 treatments and it's not changing, make sure you let the practitioner know, because they need to just change up the frequencies or the depths of the laser that they're trying to reach. It's important to speak to the practitioner and let them know how you're doing. You should see some changes in 3, 4, or 5 laser treatments. Okay, and again, depending on the strength of the laser, it might take a little bit longer. I would say his whole treatment, because we have two lasers, this is about a 15-minute treatment. Again, The time has nothing to do with it. If you overstimulate, it's not going to help. It's going to negate the effect of the laser. So you don't want to overstimulate or over inhibit with laser. And depending on the frequencies, you can either inhibit or stimulate soft tissue. So what we're doing is we're actually stimulating, healing, and repairing. We've already done with him the inhibition and the pain relief. So he has pain from time to time, but it's not nearly as severe, is it? So you said it was about 40% better. How about the pain itself, the intensity of the pain? Is that also 40% better?
Yes. Yes.
So that's good. The intensity when he does get the pain is about 40 or so percent better. And also the frequency, right?
Yes. I mean, the higher the frequency, I think it's helping more, right?
Well, I meant frequency of how often you get it.
Oh, okay.
Do you get it 40% less?
Yes. Yes.
Okay, so that's what I meant. Yeah. But yeah, the frequency, the higher the frequency here on this laser, the more on the surface. So the lower the number, the deeper it penetrates.
Okay.
Okay. Sometimes a little bit opposite of what you might think. Now we're getting through the hairiest part of his chest. Again, if you have dark hair and you got a lot of it and you have to laser over that area, just trim it. Especially if you're going to rent a laser or if you're going to go into another doctor for laser treatment for your costochondritis. And if you do go and you're serious about it, you can't just go once a week. It doesn't really work that way. It really needs to be done, I would say, a minimum starting out 3 times a week. For a week or 2 minimum, and then you could probably go down to twice a week as it's starting to improve. And when you start to see a 50% improvement, I think you can go down to twice a week. When you see another 50% improvement, you can go down to once a week. But typically 3, and sometimes we'll even laser 4 or 5 times in a week. Just depends on what we're dealing with, how severe of a condition we're dealing with, you know. If you guys have any questions about cold laser, low level laser, photobiomodulation, there's a lot of different terms used. Even if you have questions about LEDs, don't hesitate to comment below in this video and ask. I'd be happy to answer any of those questions. And you know, if there's a certain condition you are wondering if laser can help, it can help a lot of different things. So ask. Just comment below and we'll get back to you and let you know. So
there's a lot of natural medicine.
Yeah, and I'll tell you these lasers are just the parameter of different conditions it can treat are really incredible, from neurological to soft tissue.
Consistency, you know, it has to be, you know, like twice a week, because you know you have to continue.
You do. Twice a week's probably not enough. If you
Right.
were to do the first week 4 or 5 times in a
Yes.
week, you would see a big difference
Right.
compared to doing, you
Yeah.
know, maybe 3 times a week. It might take a week or 2 to see a difference. Whereas if you did it every day, you would see it within a, you know, 2-3 days. You would see the difference. We had a patient just last week that was a little skeptical. She said she just brought the laser back last week. She has sciatica and has a baby at home, and she's just busy, you know, and she can't bring the baby here on the subway. And so I told her to take the laser. She had a little flare up of sciatica, and she was not really a believer. And then she took it home, and She came back and she said, wow, she wanted to buy one. You know, and she saw how effective it was for that entire long week that she wasn't able to come in, and how much it helped her. So sciatica, occipital neuralgia, carpal tunnel syndrome, herniated discs, costochondritis, I mean, just so many different things. Sprain of your if you sprained your ankle, or you have tennis elbow or golfer's elbow, so many different conditions. Just ask, just comment below, and if it is something that can help you or your condition, I will let you know. Now, some people with costochondritis have more complications in this area. They have scoliosis, right? That can definitely complicate and aggravate or create a case of costochondritis, but you don't have to have scoliosis to have costochondritis, okay? You could just have bad posture. He has a little bit of rotation right here in his spine. We're gonna correct that. Bend your knees for me. Take a deep breath in, blow out. Good. And again, deep breath in, all the way out. Good. Lower your legs. Okay, turn over on your back. And cross your arms in front of you. Tuck your chin. And blow out. Good. And another one, deep breath in. And head back. Okay. And the last video we adjusted his ribs. He was sore afterwards. So we're going to see how he does. We're not going to adjust the ribs down today. We did a lot of the laser to calm the inflammation down. And I want to see how he does with that compared to the rib adjustment. We did not laser your chest last time, right? So we're going to compare the two, and this will be a good way for you to analyze what's more effective. But I think you will find that the laser is the most effective. And hands up.
Yes.
I think you already know that too.
Yes.
Okay, relax your arms. Any headaches?
No, no headaches.
Relax here. Okay, you're all set.
All right, thank you, doctor.
All right, you're welcome.
You are the best.
All right, now tomorrow,
Yes.
class, 8 a.m. Talk to Sam about that. And let's get you just on the movement track, you know, just
Okay.
getting you moving more.
Okay.
Just because of your job, you know.
Absolutely.
I'm lucky, my job, I move a lot.
Yeah.
So we don't have that luxury.
Yeah, I know. You don't move so much.
Thanks for tubing in.